South Africa's 10th medical school is ready to open its doors this year. The Nelson Mandela University will now also be teaching and training doctors. The medical school is located at the university's Missionvale Campus in Port Elizabeth, where applications started today. The new faculty will use a community-based approach, and its students will, from as early as the first year, be exposed to primary health care within communities. Lerato Fekisi has more.
What is really exciting about the Nelson Mandela Medical School is that it's not only the first of its kind in PE, the second of its kind in the Eastern Cape, but for me it's about the community-based approach this medical school is taking. Through our interactions with the various deans that are part of this medical school, they've said for them they want to produce doctors that, yes, can compete globally, but also medical staff that has a passion to help the poor, a passion to help those that are challenged socioeconomically. And that is why it was so important to place this medical school at the heart of the township in Missionvale, where people are marred with various socioeconomic issues. But I met a lady who is so passionate about this medical school because she's the acting dean of the faculty, and her name is Professor Delana van Rooyen. When we talked yesterday, you were so passionate and saying, you know what, not only this is the first medical school, but it's coming to your specific faculty, which is already doing well in terms of sciences. What does this medical school mean as it falls now under your specific department?
Yes, we are really excited about this happening, and especially also as a faculty, because it will assist us to deliver on the mandate that we want to be not only a university but a faculty in service of society, and to co-create with our practice partners a socially just and sustainable world, particularly in relation to the healthcare context. So as a faculty that already have numerous other disciplines, for instance, nursing science, pharmacy, emergency medical care, radiography, psychology, etc., this medical school will just assist us to further our work around interprofessional education and collaborative practice, to holistically look and care for the patients we serve in our host communities. That's not only just based around Missionvale, but many of the underserved communities will be serviced by our students.
Professor van Rooyen, when we talked early on, you spoke about that the specific medical school has got an interesting curriculum. Yes, it is another medical school among 10 others in the country, but there's something unique and special about this one. Can you elaborate more on that?
Yes, we consulted quite widely initially because there's many changes in medical education around the world, not only in South Africa, but specifically in South Africa. Our focus was very much around community-based care for our patients and families, that is, in communities. But what is unique about our program is that also not only does it have a very strong primary healthcare focus or community-based healthcare focus, but also it's technologically quite high advanced, as we have some of the best equipment and latest technology to train and teach our students on the Missionvale campus. And then I think also what's very unique, as I shared with you, this is a large faculty with many health professionals, is that we have a very strong interprofessional education approach, where in teams, through collaborative practice, all the health professionals look at patients holistically and plan the care together, and respecting and understanding the role and the uniqueness of each role, of each discipline's role, and not elevating one above the others. And that's why I think our program is very unique. And then, sorry.
No problem.
And then also, you know, we really were very privileged and blessed to acquire wonderful faculty to resource the medical school. They are experts in their various fields, our medical physiologist, our anatomist, the director of our medical program, as well as the curriculum coordinator. We're really blessed to select the best of the best to assist us in establishing this medical program.
You also spoke about the importance of working with Walter Sisulu University, because obviously they were the first to have a medical school in the Eastern Cape, and you said it's more about a collaborative effort to try and learn from each other to better the doctor skills and the doctor deficit in the Eastern Cape as well.
Yes, I think for a province with all the challenges like Eastern Cape and the health disparities of the many underserved communities, for us as a faculty, for the medical program, but also the rest of the faculty, it was very important to work collaboratively in a spirit of collaboration, not competition. And to resource the health system better. Walter Sisulu have been doing medical educations for many years, so they can take hands with us and teach and help the faculty to reach that goal as well, to produce more doctors for a province like the Eastern Cape. So for us it's very important to build this on a collaborative effort.
Then lastly, Professor Van Rooyen, you have been here from the onset, from when you were doing applications to when you were eventually approved. What do you hope as an acting dean that this specific medical school will do for the Eastern Cape and also the country and perhaps globally as well?
I think a really good medical school is driven by the health and the wellness of the host communities that they serve, and facilitating for students that that they need to be part of that service to society. And we want to, through this program, teach our medical students that a great physician is there to serve others. And that's why the human face of medicine is very important for us. And we want to create lifelong learners so that our students can function in various settings, for instance, a community health settings, or even a highly technologically, clinically advanced setting, and that they have the adaptive expertise to adapt to whatever context they find themselves in. So for us as a faculty, that's very important.
Well, that was Professor Lerato Van Rooyen, the acting dean in the Department of Health Sciences at the Nelson Mandela University, saying that what they want to achieve, besides just being the second medical school in the province, they want to produce quality doctors that understand that above everything else, being a medical professional is about putting the services of people first before yourself, and that's what's important for them as well. But for now, let's go back to you in studio.
All right, that's Lerato Fekisi for us at the Nelson Mandela University in Port Elizabeth.